once again we are back on Soch Tea Talk Train of and Thought with a series of an episode with Dr. Chris D'Souza. Sir, welcome once again. We have seen Sir's journey as far as education, qualification which are concerned, his practices which are concerned, and we have also seen the challenges during pandemic, the way he had gone through the entire process, touching the heart of millions of people, and also in the process compiling the two books as far as the pandemic challenges which are concerned and as far as the head and neck cancer care in pandemic which is concerned. Imagine doing and practice and putting it on the paper, the experience which are there. That's I think hats off to Dr. Chris D'Souza for the kind of an initiative of giving it back to the society. So now in this episode we'll be taking as far as another important organ of a body, that is an throat. So what are these symptoms of a throat problem?
The common symptoms of a throat problem will be pain, especially pain when swallowing. Then a person will have a chronic cough. There will be constant throat clearing. And lastly, because the vocal cords are situated over there, the person will complain of hoarseness or change in the quality of their voices. Now, a person who who's a smoker will definitely have problems related to the throat. They keep on coming time and again, and I keep telling them, please stop smoking. I say, don't lessen smoking, but you have to stop smoking. The danger is this, that it has been found that apart from the harmful cancer-causing chemicals which are known as carcinogens, also the temperature inside your mouth goes up by 1 degree Celsius. Now if you see, 1 degree Celsius causes global warming, where the Arctic ice shelf and the Antarctic ice shelf melts. So you can imagine what harm it can do to your mouth. If a person stops smoking, for example, on the 1st of January, it takes 1 calendar year of 365 days for the temperature to return to normal. And after stopping smoking and leading a healthy life, it takes 15 years for the person's risk factors to come down to a normal person. So that's how harmful smoking is. The other thing is that the person can get acidity, reflux. What happens is that the acid in the stomach, which is responsible for digesting food, comes up to the throat, and that's why they get pain. And the common problem is throat clearing. They'll be whenever I tell them that, they say, but doctor, I don't have acidity. So I tell them that acidity comes in 3 stages. Occult. Occult means the person, I do not have acidity. First one is throat clearing. The second is that the second stage is when the person is burning and the person has discomfort. And the third is when the person actually will vomit. So then it's proven that after you vomit that you have acidity. So we try to prevent the person from going to the third stage. And can the first stage lead to problems? Yes, it can. So especially if people who drink all these artificial cold drinks and things like that, they're extremely harmful to your system. So they can cause changes in your stomach as well as in your food passage. A lot of people don't know that they have diet this and diet that. It's harmful. If you look at the warnings on these beverages, they say do not drink if you have PKU, phenylketonuria. Many of these, what has been thought is that, as I said, a person who smokes at the age of 20, by the time they reach 60, they have a health problem in waiting for them. But children who start drinking soft drinks at the age of 5, by the time they reach 15 to 20, they already have pre-cancerous changes occurring in their food passage in the stomachs. So that 40-year period has been brought down to a 15-year period. Secondly, there's an epidemic of obesity in the young, and of course juvenile diabetes, which then lead to problems like kidney failure. So you can see how a simple problem in the throat caused by all these problems can result in long-term effects on other organs of the body. And lastly, the vocal cord, which is an organ of communication. If a person cannot speak properly, then their ability to communicate will be affected. Also, people who smoke, people who get acidity, sometimes will also come with early changes of cancer of the vocal cords. So we have to make sure that we get it right, because we have all the expensive equipment to examine, to see clearly, document those changes, and tell patients, don't do this because it's leading to your worsening of health.
I think what important insights on the health factor, the parents, everyone out over there, like if you're into smoking, just listen to what Dr. Chris has said. We should not get into those kind of stuff. And secondly, also obesity, when we talk in terms of maybe children, they are more towards the soft drinks and all, which can have an impact at a later period of time. Like, so that's what the talk is all about, sharing like the actual practices or knowledge with you, so that we can take a precautionary measure which is there. So what is a viral throat infection like, which normally was get?
A virus differs from a bacteria. Virus forms into the twilight of organism. They say it's not alive, but it's alive. So a viral infection is completely different from a bacterial infection. However, the dictum is, if a virus enters your system, a germ is not far behind. But a virus is a substance that will go into your cell and use your cell mechanism to duplicate itself. Whether a germ will divide and lead to more germs. That's the single most important difference. But a viral infection is made itself felt by fever and an excruciating body ache out of all proportion. This is the hallmark of any viral infection, that they'll have a severe body ache, and an old term that was known as malaise. Malaise means feeling unwell. And at times the person will have such high fever and out of all proportion to what you see. So you know that it is likely to be a viral infection.
And so what illness starts with a throat problem?
Most illnesses will start with a throat problem because the throat is the entry into the body, into the lungs. So symptoms like a cough, fever, change of voice, and most importantly, I tell my students is that you have to look for discharge. The hallmark of any infection is a fever and a discharge. So I always ask my patients, what is the color of the discharge? Is it yellow, green or white? Or is it blood stained? So depending on what they tell me, you know how severe the infection is. So this is a very important factor. Cough, discharge, fever, sore throat and the like, and malaise.
I think you should take a precaution whenever like you feel this kind of symptoms which are there. Just go to the experts and share like what problems you have faced. So one more, is ginger good for sore throat?
Yes, it is a home remedy. It is good. It is good for the throat. Now people come to me and they give it a different combination like ginger and milk, ginger and honey and the like. So I tell them, look, you know your body much better than I do. So examine carefully what combination suits you best. And yes, I advocate ginger as a good home remedy. However, it should not be done in exclusion to other remedies that are there. It is an add-on. That is to say that sometimes when you take a tablet, that itself can cause you a lot of gastritis. So people who take ginger in combination with whatever will soothe their throat. I said, lovely. But don't take that alone. Take the medication as well along with it.
Okay, good. And also, like, does COVID affect the throat?
Yes, that's how COVID enters the system, through the nose and the throat. It most certainly affects the throat. It comes into the body from there first.
So I think valuable insight, the exclusive insights by Dr. Chris on T-Talk platform. In this episode, we did spoke about as far as the important organ of the body, that is the throat, and how one should take care of the things, what to have, what not to have, and what kind of precautions what you need to take. If for further episodes with Dr. Chris D'Souza, please keep on watching T-Talk Boond Soch channel. Catch up with Dr. Chris D'Souza in our next episode to know about as far as another important organ of the body, that is an ear. So thank you very much for valuable insights. Thank you very much.
Thank you, sir.
Thank you.